One of the newest sleep medicines on the market is a medicine that actually works on the melatonin system in the brain. People have heard melatonin. Melatonin is actually a hormone in the brain. And the way this works, it's interesting. It's a little complex, but it's interesting. In the back of our eye lies our retina, where our vision lives. And you have two major types of cells in the back of your retina. One type of cell that's better at sort of seeing color, and another type of cell that works more in black and white. But together, these different cells give us our visual acuity. They give us the ability to see color, to see sharp, crisp edges, and to detect movement in the environment. And that's the majority of cells in our retina. That's 99% of them. But 1% of the cells in the back of our eye are really old. Evolutionarily, they're really old types of cells. And the only things these cells do is they count how much light there is. And when light gets below a certain level, it sends a signal back to a different area of the brain using the brain chemical called melatonin. And melatonin turns on the circadian, you've heard of circadian rhythms? The part of the brain that regulates circadian rhythms is this structure with a big long name called the suprachiasmatic nucleus. That just means it's this cluster of brain cells that lives above the area where the two major nerves from your eyes come together. And this structure is in charge of being your body's timekeeper. And this sets our normal circadian rhythm. Our normal circadian rhythm isn't exactly 24 hours. Our normal circadian rhythm is actually just a little bit longer than that. So if we took us all and if we were to board up this room, turn the lights down about halfway, and keep us here for weeks or months, our body clocks wouldn't follow the normal 24-hour day that we have here on planet Earth. It would run just a little bit longer than that, probably 24 and a half, 25 hours, and eventually we would get out of sync with the normal day. So melatonin does two things in our brain. Number one, it resets that clock so we stay in sync with our day. And number two, it provides a signal to turn off the brain's alerting systems so we can fall asleep. And that's what this new class of medicine works on. It works on the brain's melatonin system. So we're getting smarter about figuring out ways of using medicines to help treat some of these sleep conditions. But again, none of these things work for everybody, and none of these things are without some potential for side effects. I mentioned that one of the reasons I'm interested in sleep is because sleep really impacts a lot of other areas, a lot of other disease states. As a psychiatrist, as somebody who treats diseases involved, such as depression or anxiety or schizophrenia or bipolar disorder, sleep is really a big part of all those disorders. For example, if we look at our patients that have what we call refractory depression, patients that have depression that despite our best efforts and our best medicines and our best therapy and our best forms of treatment doesn't get better over time, what percentage of those people do you think have a sleep problem? What percentage of those people do you think have sleep apnea in particular? It's about 20 to 24%. The overall rate of sleep apnea is more like around 5%. So a 4 or 5-fold difference in the prevalence of and how often we see sleep apnea just in that population. People have heard of fibromyalgia. Fibromyalgia is a disease state where people have multiple types of symptoms. They have pain symptoms. They have specific pain along certain trigger points in their body. They also tend to have a lot of problems with fatigue, muscular weakness. They seem to really respond slowly after an injury in terms of their ability to heal. They have really high rates of depression and anxiety. There's a lot of people that feel fibromyalgia may primarily be a sleep problem, because one of the things that you see pretty consistently in folks with fibromyalgia is that they don't get to the lower stages of sleep, what we refer to as slow wave sleep, or stage 3, stage 4 sleep. And the lower stages of sleep are really important, because our body, even though our body is at rest, on the outside, on the inside, it is really active, doing a lot of important things. During slow wave sleep, we do a lot of hormonal work for our body. Testosterone, we build a lot of testosterone during that short period of time that we're in slow wave sleep. Thyroid hormone, we build active thyroid hormone from inactive thyroid hormone a lot when we're in slow wave sleep. We're able to relax ligaments and tendons the best when we're in slow wave sleep. growth hormone, which is important in our body's ability to grow cells, to build muscle tissue, to build lean muscle mass. We produce probably, of all the growth hormone that you produce as an adult, probably 80 or 90% of it you produce during that hour or so of slow wave sleep that you get each night. So imagine what people might look like if they're just not only if they're not having a problem or if they're not sleeping well, but imagine what people might look like if there's an impairment in their ability to get to that really high quality sleep. They might look tired. They might look achy. They might look sort of like they have muscular weakness, or they have trouble repairing tissues in their body after an injury. So that's one of the reasons that we're really interested in sleep, is because we know it has a dramatic effect on a lot of other kind of conditions, other kind of pain conditions. We know that when people sleep better, they tend to have less pain, they tend to use less pain medicines. When people aren't sleeping as well at night, they tend to rate their levels of pain as worse during the day. They tend to use more in the way of pain medicines. Same thing with anxiety. There have even been some studies suggesting that people that have chronic impairments in sleep have shortened life expectancies. In fact, if you look at people that sleep considerably less than 4 or 5 hours a night on a consistent basis, or if you look at people that sleep too much, if you look at people that sleep more than 10 hours a day on a consistent basis, they tend to live less long than the average person does. If you see people that are fighting their normal body clocks, if you see people that do shift work, people that work third shift, that takes a toll on people's bodies. There was a study done a number of years ago looking at emergency room doctors that worked swing shifts, who changed their schedule day, night, days, evenings, nights. And on average, they lived like 5 years less long than other physicians did. So fighting your body's natural sleep cycle and doing that on a consistent basis has potential risks. It may be medically dangerous in some ways. How are we doing on time here? 30 minutes there. Let me sort of pause at this point and just sort of open the floor for any questions or comments that people have about either what we've talked about tonight or just other questions that people have come in with.
We have, in the last year, John and I have started taking some vitamins.
Mm-hmm.
Right Choice or something like that, health-wise vitamins.
Mm-hmm.
We take 3 prescribed, we take 2 pieces in the morning and then 2 at night. And I take them right at bedtime. And I have noticed since I've been taking them that I'll wake up throughout the night more frequently, wake up and see what time it is. Oh, I have some hours yet to sleep. And I go right back to sleep. And I do seem to have a little, well, I guess less fatigue, I would say, more energy. But I think I feel a little better taking them over the last months now.
Uh-huh.
The person that sold us on them said, if you think you're not doing any good, stop taking them. Well, we haven't, because I think we do have, like I said, a little more energy, speaking for myself anyway. But what about that when you wake up like that and still get up just as early? So that's the question.
The question was about use of vitamins, use of supplements, and the extent to which you notice those things are helpful and may help to improve energy. But as was mentioned, maybe noticing waking up in the middle of the night, but being able to go back to sleep, waking up at the normal time in the morning, and in general feeling like your energy is overall better. That's probably okay. Again, waking up once in the middle of the night briefly and then being able to go back to sleep is probably not a huge impact on your overall night's sleep. So if somebody is missing out on 15, 20 minutes of sleep, that probably is not nearly as bad for a person as somebody who has a more chronic pattern of insomnia where they're having multiple awakenings during the night, waking up and maybe not being awake for 5 or 10 or 15 minutes, but maybe they're up for half an hour, hour and a half, and maybe they do that a couple of times at night. And I always tell people that the proof's in the pudding. So certainly, if I have somebody that's in my practice that is taking a vitamin and they had an experience like that, I would say that's fine as long as you feel like your energy overall is better and it's not being significantly disruptive to your sleep. I wouldn't see that as being a problem.